All right, welcome everybody to the 2024 CSDA Special Districts Tour. This is all about special districts impacting mental health, but it's also about special districts addressing some of California's biggest challenges at the local level, with mental health being one example of that. So before we get started and I turn it over to the stars of your show, your local service specialists, I'm going to give you just a very brief presentation about what is a special district, in case maybe it's something that you are familiar with your local special districts, but you didn't necessarily know that that is a special district. So for the next 5 minutes, I'm going to walk you through a few examples and a little bit of explanation, and hopefully that answers your questions. But if it doesn't, as Rachel said, please type your Q&A into that Q&A box throughout the presentation, whether it's me presenting or one of the stars of your show. So first up here on your screen, you're going to see, as I mentioned, local service specialists. At the end of the day, that's what special districts are all about. They're about combining local, meaning a direct connection to the community that starts the special district, that forms the special district, that elects its board, and that receives its services, into the service that they are receiving, that the community has identified that they need. And then, of course, the specialists, the types of folks that you're going to hear from today that are focused singularly on a mission, which is bringing as efficiently and effectively as possible the solutions to a challenge that a community is facing and solving those problems at the local level. Here's an overview of some of the types of special districts throughout our state. Of course, here today, we're going to hear from a recreation and park district, as well as a fire protection district. But we also have water districts, sanitation districts, flood protection, mosquito abatement, healthcare, ports and harbors, airports, essentially all of the different types of local and regional services that our state needs from an economic standpoint, from a health and wellness standpoint, to get answers to our solutions as a community. Special districts can provide. Here's just some examples of some of the numbers from across the country. This is from across the state of California in terms of special districts serving both large and small populations, urban and rural. They are really throughout the state. You'll tend to see more special districts by number in the inland rural areas, but larger special districts serving larger populations on a regional basis in the coastal and urban areas. So, of course, there are three major types of local government: special districts, which we are, and you're going to hear from today, which provide a specialized, focused local municipal service. Then, of course, you have your cities. Cities do that as a general purpose, but they also have land use planning authority. And then your counties, which can provide some municipal services. They also have land use planning authority in your unincorporated areas. And then they provide a number of different state mandated services, such as courts, sheriffs, you have elections, you have public health, some of those different areas that the state does require, and they're essentially an arm of the state in delivering those services. Here's a visual representation of that. Every resident, every family, every business, every community has needs, and it's about bridging the gap to those needs. And that bridge looks different in each region of our state. We live in a very diverse state with varying needs based on the topography, the politics, the population, the whole socioeconomic setup of that community in that region. But each community has the flexibility to its own journey toward meeting those needs. Special districts can provide a key segment of that bridge when there's an opportunity to specialize. And I think you're going to hear today some of the advantages of when you can specialize in a particular service that is needed in a community or region. So why special districts? Again, there could be a need that's simply unmet. You might be looking to simply elevate the level of service, the quality of service, the amount of service. You might be looking for an economy of scale, typically in a more urban area. You might be looking to provide a service that could be provided for multiple cities or even multiple counties. Special districts are a type of agency that can cross city and county boundary lines. They're also custom tailored to the specific needs of that one area. It's not a one size fits all solution. And again, by focusing on doing one thing and doing it really well, there are opportunities for efficiency, for resiliency. So you can see that as you kind of move out into these more specialized governments from the sort of largest example we have, which would be, of course, be the federal government, you have opportunities to increase localization and specialization. So why specialize? Why is that a word I keep saying over and over? Well, it's in our name, special district, but there are reasons for that. And you can see them not just in the public sector, but in the private sector. I mean, think about this. Would you want to buy shoes made by Southwest Airlines? Does that sound like a comfortable footwear? Well, even if that may be the case, you probably wouldn't want to fly McDonald's Airlines. That might not feel as safe and secure to you or as comfortable of a flight. And then lastly, of course, even if you might be willing to fly there, do you really want to eat pizza named after and run by a shoe company? Probably not. And yet all of these different industries, Nike specializes in shoes, of course. McDonald's specializes in fast food, and Southwest and airlines. And they do a phenomenal job of where they focus and specialize. And we believe that in government, it's no different. By having a government focused on a mission, it allows them to really specialize, innovate, and be efficient and effective and meet the needs of our residents, our mutual residents and constituents in the most affordable way, but also the highest quality way. And so how are they formed, special districts? Well, they're essentially formed by the community at the end of the day. The process can sometimes go through the legislature. Otherwise, it may go through the LAFCO. But at the end of the day, it's the residents paying for and receiving the services that make the final decision. And how are they funded? There's a suite of funding. There's not as many elements to that portfolio as you might see in a city or a county. And oftentimes, the special districts may only receive one or two or three of these types of funding streams you see. Property tax is very valuable to special districts like rec and park and fire protection districts, and rates and fees are very valuable to your water districts, your wastewater districts, your electric utility districts. But at the end of the day, despite the limited amount of revenue that special districts receive, you can see that they perform a large percentage of the services throughout our country. There are 2,000 special districts here in California. There's about 40,000 of them across the country. So 5 things I want to leave you with is that they are, as you'll see today, addressing some of our state's biggest challenges at the local level. They are critical to our economy, our infrastructure, our resiliency. They specialize. They are rooted in a community and tailored to meeting the affordability of that community. And finally, they're improving services in ways, real tangible ways people can see and feel. And so we are looking to partner with you, the state. We are so grateful that you took the time to be here today. We want you to reach out to our team for any of the areas that we focus on for local government on behalf of our members. And we'll be happy to take your questions at the end of this presentation. With that, it's my pleasure to introduce our Director of State Legislative Affairs, Mr. Aaron Avery. Aaron, if you'd like to introduce yourself.
Thank you, Kyle, and good morning, everyone. While our legislative assistant, Anna Callahan, is getting our first video teed up for you all, I just wanted to share a little bit of information about our legislative team here in Sacramento. As Kyle said, my name is Aaron Avery. I'm Director of State Legislative Affairs for CSDA. So in that role, I have the privilege of working with the entire legislative team, but also lobbying on a portfolio of bills that includes labor and employment legislation, Surplus Land Act, and bills and legislation affecting our water districts. I'm joined by 2 other lobbyists, in-house lobbyists here in Sacramento, Marcus Detweiler, who covers local revenue and governance legislation, and Anthony Tannehill, who covers environment and disaster preparedness, state partnership, and public works. What I really want to just leave you all with is to let you know that not only are we a resource, our lobby team, for our 1,000+ special district members of CSDA, but we're also a resource for you all as well. So anytime you have a question or a policy issue arises that might potentially have an interaction with special districts or affect us, please feel free to reach out. On the previous slide Kyle just shared, there's email information for everyone on the legislative team. But if it's not clear who it should go to, just send an email to me or give me a call, and I will either answer your question or make sure it gets to the right place. So with that, I want to thank you for your time. I know your time is valuable, especially this time of year. And Anna will launch our first video presentation by the San Ramon Valley Fire Protection District.
I think we're actually in a crisis with mental health.
We have seen in the past 5 years an increase of upwards of 200 to 300% in mental health calls.
We're seeing more and more patients in the emergency department, more and more patients reaching out for help.
The San Ramon Valley Fire Protection District is a special district, single purpose. We provide fire and EMS, emergency medical services, to the community, as well as protecting property. We also are uniquely an ambulance provider. Every call we go on has a mental health aspect. And when I reflect on my career and I look at the calls I've gone on, it was so obvious the mental health crisis that my patients were going through and family members were going through, but I didn't see it like that 20, 30 years ago.
So my role as the emergency medicine physician and advisor and counsel is to help develop a program. Chief Meyer presented the issues that were going on in the community. He asked us to solve the problem, and we developed our fire first response. The traditional response with mental health calls was that police would respond to the call and fire would stage. However, we decided to reverse that and let the mental health professionals, healthcare providers respond to these calls first. So the paramedics respond first and now the police stage.
The Firefighter First program is designed to assist anybody that's experiencing a behavioral health emergency within the community. They call 911, our dispatchers triage the call that comes in, and then they're able to either transfer that call to the Warm Handoff 988 center or dispatch our fire and police resources to respond to provide whatever aid that that person may need. From our understanding, this is a first of its kind program. And the reason it's a first of its kind program is because we take different aspects and we've been able to merge them together to create a more holistic approach to solving these emergencies.
And their biggest issue is they want to talk to someone. And since police and fire are responding to these mental health calls, let's put the firefighters who are healthcare providers, put them in front of the patient so they have someone to talk to. Hopefully we can de-escalate, get them the services they need, and avoid unnecessary psychiatric holds.
I can't take credit for the idea because the idea was coming from my firefighters and the families that we responded to on medical calls and mental health emergencies, a frustration level that we were responding to these calls and we only had one option. We could only do what the police officer told us to do. So we were taking kids as young as 8, 10 years old, and we were taking them to a psychological facility hospital, which really, to my firefighters, wasn't in the best interest of the child and sometimes the adults. And then it also, unfortunately, led to parents calling me up because we transport, and they would ask me, why would I do that to their child?
When we respond on scene for these firefighter first emergencies, 80% of those calls no longer result in an involuntary hold to county psychiatric emergency services. That's a big deal for those patients. We know that when we transport somebody to county psychiatric emergency services, within 24 hours, 90% of them are being released. And they potentially aren't being released with the amount of care or the type of care that they need. So that's not always the best solution to take patients to that facility.
Firefighters are often seen as the most respected public servants, so having them show up builds the trust automatically because we know they carry the tools needed to provide support and resources and really have a more culturally responsive approach, meaning we see the individual who is in crisis as the primary person we need to support.
Firefighters have always been on the forefront. We've always had to deal with this issue of mental health. And it comes naturally in a lot of ways. And what we've tried to do here is leverage that engagement to our advantage in dealing with the changing times of more mental health crisis.
We get calls from family members who are so excited about what's happening here in San Ramon because it's kind of embarrassing to have police show up at your home, and the stigma that it creates, it's really diminished that for the family members, especially when it's children having police show up and individuals seeing them sometimes handcuffed and taken away versus having a truck show up followed by an EMT when it's needed. But more often than not, it's just a conversation. And through that conversation, healing begins.
What makes this program so unique and so effective is that our firefighters are able to get on scene first and provide medical care to the patients that are calling 911, I think in a way in which hasn't been done before. We're viewing these as medical emergencies, not as police incidents.
We're very focused on the community's needs. We know the ups and downs that a community is going through because our constituents and our fire board members, they have their finger on the pulse. And being a single purpose, focused district, it allows us to really be more intimately involved with the community and the things that we do.
And we're able to efficiently and effectively provide a solution to something, to this specific issue that we think has been a problem for a long time.
When you're in a special district, you have a fire board focused on the mission. And the one thing in public service is if you're focused on the mission, you get things done.
So now you get to hear from the very people that created and implemented the program. I'm pleased to introduce to you Mr. Paige Meyer. He is the fire chief at San Ramon Valley Fire Protection District, and Jonas Aguiar. He is the deputy fire chief at San Ramon Valley Fire Protection District. And for those of you that may have had some choppiness on that video, you can go to the website that Rachel laid out earlier, and you can find all of these videos linked to that website where you can watch them in full or share them with others. With that, Paige and Jonas, I'll turn it over to you.
Thank you, Kyle.
Thank you.
Yeah, the program itself is a lot less choppy. How about that? We're excited to be here to give you some stats. Though this program is one of a kind, I think I really need to emphasize that to the folks out there. A little controversial in that for the first time in the history that we've dealt with fire service and what I've seen, we actually, if you caught in that video, we are going into these calls that typically are police responses, 911 calls, we're going in first. And I think that it's been such a success. And at first, very looked at as maybe a little dangerous, a little bit out of the box. But we are treating these as mental health calls, as was said in the video. So we're excited to show you the statistics that we have. It's been a huge success, and I'm going to turn it over to Chief Aguiar to kind of go through the numbers and then answer your questions.
Thank you, Chief Meyer, and good morning, everyone. Thanks again for having us here. We are excited to be here presenting about our program, and this is a presentation that we've done in multiple different locations across the country this year alone. There's a lot of interest in this program, and I think once we start getting into the different numbers and the benefits of the program, I think you all will understand why. Just a little bit about our special district, though. We're located in the south end of Contra Costa County. We serve a population of about 200,000 residents. We have 9 stations and 5 transport ambulances, excuse me. So we're a medium-sized fire agency that was able to pull this off. For us, recognizing the need for change, it was very apparent. And I know that we've all talked about the increase in mental health issues over the last 4 years post-COVID, but we were seeing that change, or we were seeing that increase in mental health calls even dating back to 2014 and 2015. It just got to such a boiling point that we saw after COVID that we knew we needed to do something about it. We needed to act. What we've seen at our psychiatric emergency services department in Martinez is we've seen a significant increase in transports of patients to that facility. We only have one facility that we can transport to in the entire county, and that's located about 45 minutes away from our jurisdiction. So 90% of the patients that get transported there are then released within 24 hours. And for us, we've also seen a staggering number of children that are experiencing behavioral health issues. And again, the only tool for us to utilize when dealing with children was to take them to the one facility that we have. And we all knew that that wasn't working. We knew that it wasn't a one-size-fits-all solution. Everybody has a different need when it comes to behavioral health issues, and taking them to and on an involuntary hold was something that we recognized very early that we had to do something about. We also knew that with these increases, not only in our district, but across the entire county, that this one facility wasn't going to be able to accommodate that surge in patients. And we were seeing wall times with our ambulances at that facility, on average, approximately 2 hours. But we actually had some that were as long as 6 hours that our ambulances were waiting there to transfer a patient to psychiatric emergency services because of the amount of patients that they had in their facility. So this slide here is an amazing slide, and one that I could talk about easily for an hour, even though I only have about 6 minutes to go through it. But it really highlights, since this program went into effect back in October of 2023, a lot of the benefits of that program. As you can see, primarily through our program, our personnel arrive on scene. They avoid escalation by minimizing PD contact, and they determine a course of action that's best suited for the individual patient. Again, we've moved away from that one-size-fits-all solution, and now we're able to better tailor the needs of the patient with our EMS crews on scene. For community benefits, again, what we're able to do, and Chief Meyer mentioned it briefly, is to change how we view these types of emergencies. Previously, PD would arrive on scene first, and these emergencies were deemed more as a police matter, and it made the patient actually feel like they were the perpetrator of some kind of crime because PD was there with them first. For us, when we're able to arrive on scene, we're able to de-escalate the situation. We're able to have direct communications with the patient or their family members, and then we can come up with what is the best solution for their individual treatments. And then for the district benefits, and I'm going to speak more in depth on it on the next slide because we have some specific statistics that highlight that. But really, the district benefits are overwhelming because due to this program, we're able to keep our fire resources available, our EMS resources available, and our PD resources available for more emerging calls. We're able to get the patients that are having behavioral health emergencies the care and treatment they need in a faster time, which allows those resources to free up sooner to be available to respond to other emergencies that are happening within the district. And some of the statistics that we're able to pull, and we really have a lot of faith in these now because it's been over a year. We have a good sample size of how our program is actually working and affecting the community. The first one I want to talk about is the 6.3% for warm transfers. That means when somebody calls 911 and they're experiencing a behavioral health emergency and we triage that emergency, we take 6% of those calls and we transfer them directly to the crisis center, which is also our 988 receiving facility within the county. And that allows phone counselors to handle these patients that are calling in, and we don't dispatch fire, police, or EMS resources. So that never even gets out to the line or to our personnel on the line. It goes directly to the crisis center, which is a great benefit to the community, again, keeping our resources available. The next part of it is if we do dispatch fire resources, 16% of the time it's a firefighter first response, which again means our personnel arrive on scene. They speak with the patient first. The police department stages outside, and together our paramedics and first responders are able to determine the best course of action for treatment for that patient. Now, of those that we arrive on scene for a firefighter first response, this is a very staggering number for us. 84% no longer are placed on an involuntary hold and transported to psychiatric emergency services. This is one of the biggest statistics that we have because it shows the direct impact to the patients that are out there in the field. We're able to come up with a plan that is better than just transporting them to psychiatric emergency services, allowing them to see their own clinician, allowing them to go to the hospital if they choose, or just to create a safety plan with their own family members at their house, or just call a counselor on the phone. 83% diversion rate, which is phenomenal. And then the last one is this 21% reduction of total time on task. That means that when we respond to these types of calls, now it takes 20% less time. And our crews and resources, like I said, are available for fires, they're available for stroke calls, they're available for heart attacks, they're available for police matters. And these patients are getting treated with what they need. Our crews are being available much quicker, and it's allowing us to provide better care to the community. And with that, I just want to say thank you again for having us here. We're happy to answer any questions you may have. And Chief Meyer, if there's anything you'd like to close with.
Yeah, just a couple points. Remember, this is a 911 response. Sometimes people get confused there because there's a lot of community responses in other areas of the state. This one is a 911 response, and it's the first of its kind in the country. I think that's important to note because it changes the way we do business. And I hope you see that. That could only be done, in my experience, coming from a city to a special district. This is, in my opinion, the only way I was going to get it done was to have the ability and the autonomy to really push this program. So we're really proud to be a special district, and we're happy that we were able to make this move in the way we look at mental health and responding to it. So thank you.
Thank you, Chief Meyer, Deputy Chief Aguiar. What wonderful work that you guys are doing. Very proud of you all as our members and special districts. Thank you. With that, we're going to transition into, we've gotten an opportunity to see emergency response sort of on the back end of what happens when somebody's going through a mental health crisis, but what can we be doing to prevent and address crises up front or to keep them from becoming a crisis? Let's watch our next video from Hayward Area Rec and Park District.
Parks and recreation is the answer to so many social issues that you have, from physical health to mental wellness.
Post-pandemic, we've seen a lot of kids really suffering from a lack of socialization.
People are becoming more anxious, a little bit more distressed, and trying to work their way through this.
The Hayward Area Recreation and Park District is a special district that was actually formed 80 years ago. It's our anniversary. We provide park services and recreation services for 308,000 residents that live across 114 square miles, City of Hayward, and 5 areas of unincorporated Alameda County.
The way kids interact and socialize is totally different. There's a lot more screen time. So for us, getting kids outside, getting into parks and participating and being active in activities really made sense. We like to say that we have something for everyone. We have preschool programming all the way to senior programming. We do fitness, sports, aquatics, summer camps, special needs programs, the arts and personal enrichment activities.
There's just a lot of stress in society today, whether it's fiscal, political, work-wise.
Our role is to support and serve the community residents, particularly those who are suffering. And so we have several department partners, including public health. So in describing the partnership between Hayward Area Recreation Park District, I have to say that it has been tantamount. And so that work really helps us to think of new ways for some of the providers to prescribe health and wellness and going outside to the air and to breathe. So there's a really strong connection to not just the traditional modalities to help you feel better. There's actually a prescription.
Recreation RX is part of a greater health equity initiative, and how it works is a client will see their healthcare provider at Tiburcio Vasquez Health Center and receive a recreation prescription. They may be at risk for heart disease, diabetes, or just a need to get outside to relieve anxiety. And so the healthcare provider really knows the benefit of our important services and gives them a prescription to take advantage of some of the amazing things we have to offer.
You can go to a doctor and you can get a prescription for medication. This is the same concept, except you go to a clinician at a health clinic and they look at you and maybe say, you know, you seem a little depressed, you seem a little overweight, you need some activities. And people don't know really where to find those activities. By a health clinic writing you a recreation prescription that gives you all the information you need to contact the Recreation and Park Department and then be able to go out and participate in programs that are scholarship for free. It's kind of this full circle answer to trying to get people referred into healthy activities.
This is a truly proven, low cost, low barrier, easy to implement if you just have willing partners, way that people can be connected to methods that actually help them live.
Hi, my name is Helene Singer and I am a volunteer. I am the receptionist. I volunteer mainly for the sociability. I worked until I was 72 years old. I had a purpose. And then all of a sudden, nothing. It just makes me feel that I'm viable again. The population is aging. In this particular area, we have a lot of seniors. Well, the baby boomers. There's a lot of us out there. And I think we're all in the same position. We need company. We need people to talk to. They're friendly and they're lonely, and you're a happy face. It makes me happy, and I made a whole new family.
It works. It shows a person, if they're visiting their provider, that you actually need this. I'm going to prescribe X, Y, and Z to help you. And sometimes we as humans need that nudge. It is a very wise way to spend public dollars and to leverage partnerships.
I'm an independent special district of the state of California, governed by 5 elected board members. Our policymakers come from the community. They're connected to the community. They know what the community wants. They're very active and engaged. And so that allows me to take their direction in policy and be able to put it on the ground and implement it.
All the way around, it's a win-win. People from every walk of life, every language, every culture can invest. And it really does, if people are looking for a place to start that doesn't require building a building, signing a contract, you can do something very simple and something beautiful and sustainable.
In terms of our rec prescriptions, we're really, supporting how important we think parks and recreation is to people's mental health and their well-being. We're really able to leverage the resources and the facilities that we have to be responsive to the community's needs.
Once again, for those of you that might have experienced a little bit of choppiness in your video, that's an issue with the bandwidth that Zoom is able to have. And so you can watch that full video very clearly and cleanly on our website that Rachel provided to you earlier. Also, the recorded version that we're going to email out should have that all cleaned up. So when you forward that to your colleagues or your bosses, they can see it without that choppiness. With that, I'm really excited to introduce to you the leader over at Hayward Area Rec and Park District, their general manager, Mr. Jim Wheeler. Jim, go ahead and take it away.
Good morning. Thank you, Kyle. Thank you, CSDA, and everyone for joining us today. I have the honor of being the general manager for the Hayward Area Recreation and Park District. I think my main takeaway when asked about our role in mental health was basically, I think in general, the ability of park and recreations and our impact on community health and wellness is sometimes overlooked or underestimated. So today I wanted to give you some examples. In our video introduction, we talked about the size and scope of the district. We serve the city of Hayward and a lot of unincorporated Alameda County. So we are one of those districts that overlaps boundaries. And I think that allows us to be a provider for multiple agencies. This gives you a small idea of our scope. We have about 115 parks and facilities across 120 square miles. And we pretty much do everything from the emerging sport of pickleball to dog parks, picnic areas, and everything else. For me, I think one of the best things we have done as a district is we've worked on our ability to put parks in densely populated park deficit areas. We serve a portion of Alameda County, which is the most densely populated, most social economically challenged area of Alameda County. And in the past 5 years, due to passing a bond measure, we've been able to buy 4 new park properties and contributed to a low-income housing project that now has a 15,000 square foot community center that's being built in those areas. I really think it's important to understand when you think about healthy communities and belonging, our role in developing parks in places where people maybe felt left behind or forgotten helps contribute to a sense of identity for a community and self-worth. And I believe that goes a long way for mental health, not only of individuals, but in communities, nonprofit organizations we work with, and other groups. So this ability to put parks in previously underserved places where there weren't great parks. This is Mia's dream come true playground. This was started with a Make-A-Wish Foundation for a little girl named Mia who had some health issues. Her parents came to the park district. This is Tennyson Park in Hayward, California. This is one of the highest crime magnet areas in the city of Hayward. Prior to building this park, we had about 6,900 visitors to the park. This all-inclusive playground now has escalated visits in that community to over 91,000 visitors a year. So by putting these parks in places where people didn't have them, they get services, become vital parts of the community. There's economic drivers, but mostly this playground was built for children with special needs to feel like they belong and to help them deal with maybe a sense of feeling left behind. We couldn't talk about our role in mental health without talking about outdoors, whether it's from gardens to parks to open spaces and trails. We feel that our role in being able to connect people with nature, connect people with outdoor activities is a huge part. And we know that nature deficit disorder is real. We know that getting children outside and adults outside has incredible impacts on their mental health. We are strong advocates for the California Children's Outdoor Bill of Rights. Our programming tries to address these areas for youth and teens and even adults to get them to be able to understand and celebrate the outdoors and celebrate who they are. We do a lot of outdoor programming, especially in the teen and especially for our special needs populations. Um, we started the Go Hard program, which is get outside. It's a district's education and outdoor programming, and through use of some um, actually a little bit of the California Office of Finance money that was a lot allocated to the special districts. We tried to turn it around and use it nothing but for the good of people. We are getting kids that maybe have never been able to do some of these activities outdoors to enjoy them, and they just want more and more as our experience. So as you can see, we're doing many kinds of outdoor excursions and other activities for these youth. We are now to a point where teen cohorts are going out every Saturdays for excursions, giving them a chance to connect with their peers and connect with nature. And again, I know as a child, being able just to go down to the creek and play with my friends was one of the most freeing, fun activities I could ever have. We don't stop with youth. I think the first thing I thought of when we were talking about our role in mental health was, of course, our senior programmings and having activities for seniors and giving them the opportunity to age with dignity and have activities, and know that our two senior centers and our other senior programs are focused on making them understand they're an important part of the community. And again, almost similar to youth that are growing up underserved and marginalized and not really with access to activities. The same thing happens for seniors as they age up. As you saw from the incredible testimony on our video, we really think that keeping people active increases all the things that come along with social isolation, and of course, increasing mental acuity. It is amazing to me that one of our fastest growing programs, aside from pickleball, is the senior mahjong program, which, when you want to talk about mental acuity and health, that's a pretty incredible program. And again, studies have shown that loneliness and social isolation are associated with higher risks in disease. And again, our role in mental health, wellness, physical health, and helping to fight all of the disease and disorders, whether it's obesity or again, these mental health issues, we feel we play a huge role in that. We also have a very, very large program for developmentally disabled adults. We have a whole entire old school campus that is now the Sorensdale Community Center. We serve up to 90 developmentally disabled adults daily in this program, and we're blessed to be able to give these people. We have a life skills workshop, job training. We have a thrift store that they run, physical fitness room, computer labs, all with the idea of not only bringing this population together and letting them experience each other and have peer groups, but also just activities to, sometimes you maybe don't feel so special. So our goal is to make every individual feel special at these programs. It's a home base, plays a critical role, again, as I said, for socialization. The last thing I'll talk about is our arts programs. We have taken some of our lowest income areas with some of our most challenging recreation centers, and now we're providing after school opportunities in the arts and summer free arts programs and camps for over 200 low income students every week. And what we're finding is that the joy and the passion we see from these youth socializing, being able to have outlets, ceramic studios, painting studios, activities maybe that they never got introduced to. There's also a huge dance element, performance element. Recently had holiday lighting event, and the children performed on our stage at some of our mansion lightings. But again, the practice of art, the practice of dance is a common language for self-expression. And again, for me, this becomes about value and self-worth that you get from performing programs. Again, safe environments, places where you feel accepted, places where you can explore. So with that, I will say thank you so much for your time, and hopefully if you have questions, we can answer those for you.
Thank you, Jim. And thanks for your heart for all of this. Just really comes through. And the hope that I think we see when we see Chief Aguiar and Chief Meyer, in your presentations for what we can do about these challenges. Just it's inspiring. Thank you. With that, we're ready to transition into the final portion of our program, which is the Q&A section. And I want to thank those of you that have already chatted in your Q&As into that Q&A box at the bottom of your screen. Please keep them coming. We will take as many questions as we can until the 11 o'clock hour hits. I'd like to welcome the rest of our panelists to go ahead and turn on their cameras and be ready for them. I'm going to start firing them at you here hot and heavy. So we're going to start off with a question for the San Ramon Valley Fire Protection District. And this question is about involuntary commitment. So the question is, do you have the ability to compel transport if needed to address the mental health crisis? What happens if the person is resisting? Do the police need to get involved at that point, or how does that work?
Great. Hey, that's a great question. And I'll have Chief Aguirre jump in if I miss something, but basically what we do is we invert the process. So if you don't know, typically when there's a call for a possible, what they call a 5150 or 72-hour involuntary hold, in the past, police would show up. We would then stage until police said it was okay for us to go in. Now we show up first, but we probably didn't make clear enough to you. Police then stage. So they're available literally within seconds to come in if necessary, but we just keep them out of the line of sight. So we still create a safety aspect for our folks that are going into these situations. And if it does rise to a level that we feel is important to get that person more help, which the person asking the question probably knows this, takes a police officer, then we will call them in that case. So we have the ability to escalate the situation, but we keep them on the outside of it, looking in until absolutely necessary. I hope that answers their question.
Great. Thank you. Thank you. Jonas, did you have anything to add?
No, Chief summarized it very well.
Excellent. Well, we have another question for you both. And that is, I'll just go ahead and read the question directly. I appreciate the depth of training firefighters and paramedics receive. Can you speak to the training your team receives regarding mental health specifically?
No, this is a good one, actually, because we didn't have time to really get into the depth of training that we had to do for our personnel. But when we first rolled out this program, one of the main things that we identified is we don't have enough training. This isn't something that we were, when you go to paramedic school, you maybe get a 3-hour block of instruction that involves these types of incidents, but there isn't and wasn't a program really nationally recognized that we were able to bring in and help our personnel. So we brought in an outside consultant to help us develop a training module. And through that training module, we put everyone through an additional 12 hours of training online. And then we brought them in for an additional 12 hours in person. And the benefit of that is that it wasn't only just our firefighters and our first responders. We did training in the same room with all of our dispatchers, as well as all of the San Ramon Police Department. So you saw a partnership between all of these folks together in the same room, talking about the same problems, talking about the experiences on scene of these types of incidents, and then coming up with, hey, what is the best solution and how are we going to interact when we arrive on scene? And I think you see that, I know you see that with our personnel out in the field and with San Ramon PD specifically, on how this process works for us and how we do these handoffs back and forth and the words we use if we need PD to assist or if we don't and they stay outside. So developing the training module was one of the biggest parts that we had to do with this early on because we didn't have anything for it.
And just to add one last thing on that, I think it's important to note, and I mentioned it in the video, this is something we did all the time. I mean, anybody that's had to call 911 for an EMS, a fire, police intervention, they're in a state of I think, some form of mental health crisis, maybe small, but it's very stressful. So we were already kind of predisposed to deal with these, and we didn't have the training. So we started putting that together. And I think Chief Aguirre, I want to really emphasize his point about getting everybody in a room. I can tell you, we're doing 16 to 18 hours worth of training, very in depth as to looking at how to body language, everything that you can do. But one of the biggest things that we kind of byproducts that we had was when those police officers who can be standoffish and God bless them, but in their position, right? And us, and all of a sudden we're talking, and that lack of communication led to a lot of misunderstanding and frustration. I can tell you just from that training, the way that we interacted right after that, in the first months when it wasn't even fully implemented, was just phenomenal. It made, and it was for the patient. That's who was getting the benefit. And it was just amazing to watch this understanding, because when you're on different sides, cats and dogs, you guys have all heard that, right? Cops and firefighters. That's kind of how we are. You take away that edge, it was pretty amazing to see how much it helped our relationship and the patient.
That's phenomenal. And I've got a couple of questions for you, Jim. But before I do, just really briefly, I wanted to ask, we saw Nami of Contra Costa in the video there. I know I'm going to give you guys a chance. I know you wouldn't do it otherwise, but to pat yourself on the back, my understanding is they gave you some kind of an award for this program. Do you want to just speak to that very briefly and kind of what that partnership or relationship looks like with them and who they are?
Chief Aguirre?
Yeah, so Nami and Gigi Crowder, who was also featured in the video, we began a partnership with them early on as being one of the community stakeholders. Nami is the National Alliance for Mental Illness. Nami of Contra Costa County is what Gigi Crowder manages. And we reached out to her very early on in this process because we needed to get that stakeholder, buy-in from folks within the community on what is it that they're seeing that is or isn't happening on how these emergencies are handled. And through the process of developing and working with them, she actually and her organization were the ones that provided the role players for our hands-on training scenarios. And it was so beneficial because these role players all had lived experience. So these weren't people who had to come in to pretend that they had experienced this or pretend that they experienced that. These were folks that have lived this, that live it every day, and they were able to come in and provide firsthand experience for our personnel who are going through the process of learning this on how to handle and talk with people who are experiencing, this type of mental emergency or this type of mental health emergency. So Gigi has been a phenomenal partner. Her organization presented us an award last year that really was about the program and what it is that we were able to develop. And we've been very appreciative of her. I think she's actually on this Zoom meeting right now watching. So if you're there, Gigi, we appreciate you. We appreciate the work that your organization is continually doing to help, push the mental health issue forward.
And we were also recognized, and you're being humble. We were recognized not only by that great organization, but by EMS World, okay? Not state, not county, not country, but world. We were recognized by EMS World and the Dispatch Association Navigator Conference had us come in as well. So we've been recognized all over the country, and we're very proud of that.
That's outstanding. Let's talk a little bit about what we're doing over on the park side of things. Got a couple of questions here for you, Jim. Where can I find, or can you share again, the California Children's Bill of Rights that was referenced in your presentation, Jim?
Yeah, the Outdoor Children's Bill of Rights. Actually, I posted the link in the chat. It's a California State Parks program. While I was with the City and County of San Francisco Rec and Park Department, they developed their own San Francisco Children's Bill of Rights with the Presidio and the city and the Rec and Park Department and some community-based organizations. It's a great avenue for that. One of the other great resources would be Healthy Parks, Healthy People, the movement to lead outdoor walks. First Saturday walks in San Francisco, we did every Saturday walks for people to take them out in nature. So somebody who could talk about like stretching and how to go for a good hike, and then someone who could tell you everything you were looking at the time and introduce you to nature.
That's great. Let me ask you, before I get to this next question, there's been a really successful, at least in my mind, campaign called Parks Make Life Better. But I've heard a lot of our members talk about, especially since the pandemic, a sense of like, they don't just make life better, but they really are essential. I think your video sort of speaks to some of that. Do you want to just speak to that sort of phrasing and that message at all?
That is an amazing question. And with no disrespect to my friends in the cats and the dogs in police and fire, Parks and Recreation for a lot of years, and the California Park and Recreation Society and CSDA and the California Association of Park and Rec Districts, we've said for many years we're an essential service too. These outlets for people, the socialization, affordable adult daycare, for developmentally disabled adults. We really feel, but during the pandemic, you couldn't do a lot, but what we experienced and what our neighbors at the East Bay Regional Park District experienced is almost a double in visits. I'm very proud to say that we started using Placer AI to track park visits. We had 3.9 million visits to our parks and facilities last year. So this ability to get outdoor, Parks Make Life Better was a campaign through the California Park and Rec Society where they did some research into trends and people using parks. And what they found out was 94% of Californians had visited a park that year. And I'm not sure you'll find anything that 94% of Californians had all done. So it was a pretty staggering and good statistic.
Thanks, Jim. And another question for you. I think you'd probably love to hear this. What volunteer opportunities are there at Hayward Area Rec and Park District, and how do I sign up?
So, the best thing is you can pretty much volunteer to do anything. We have an animal hospital and a nature center where we have a ton of volunteers who help us take care of animals, get trained to play with the animals, which sounds like it's easy, but how do you exercise a fox, right? And then anything to the senior centers, as you saw the testimony, you can help in our youth sports programs, you can help in our camps. And all you do is come down to the Human Resources Office actually in the district, because volunteers in the state of California are now protected like employees. So we can sign you up, do a quick background check that we will pay for, and then you will be protected with workers' comp insurance out in the field, and you can volunteer to help us with all kinds of things. We're always looking for people with special interests and specialized skills to help us with programs and services.
Excellent. Here's a question that I had when we first came and toured and talked about the program there at San Ramon Valley Fire Protection District. And that is, what did the firefighters themselves think about this? And I really thought your answer, and you alluded to it in the video page, but maybe you could talk to that. Were they reluctant? Were they concerned about their safety? Kind of how did that process go?
No, that's a great question. It was, and I did allude to it. The reality of the situation was when we came out of COVID, prior to COVID, it was always kind of an issue for our firefighters to show up and then have I don't want to say a disagreement, but they didn't always agree with what the course of treatment was for the patient. And we're very, the fire department, we have these fire badges and everything, but, still 90% on average, somewhere around 80 probably percent of what we do is EMS. So we're very EMS centric. We take that very seriously. And I think that a lot of times the firefighters would be frustrated. So as that happened pre-COVID, and then as we went into COVID and coming out, we saw this spike of calls happen with a mental health aspect to it. We really had a lot of feedback between our firefighters and our EMS division and myself to say, how can we solve this problem? And that's why I give them a lot of credit. I knew there was an issue and I thought we could maybe get ahead of it. But we just embraced kind of a consensus ability, because at the end of the day, I think we all know that firefighters are problem solvers. Whatever you call us for, we show up and try to figure it out. So I think the only thing that I did was kind of push that envelope is to, help me solve this problem for the community, which also, as a byproduct, solves the issues of their frustration and taking units out of service for several hours. So it was good to come together with a common purpose. And so that's how we got there.
I love that. This question I think will be a helpful one for clarity for folks. The question is talking about how kind of the same region that Hayward Area Rec and Park District covers includes several different fire agencies. Obviously it doesn't overlap directly with San Ramon Valley Fire, but they're both in the East Bay. So the question is, in their area out in Alameda County, are you familiar, any of you of the panelists, are any of those fire agencies looking into this type of program in terms of firefighters first response? Or maybe you can expand that question just to, do you know of any others in the state or across the country that are looking at what you're doing or applying it or kind of doing parts of it?
Yeah, and jump in, Chief, if you have anything on this. We do know that there are, and you've seen this throughout the state of California and even the country, a lot of agencies doing a mental health kind of ambulance unit where they have a clinician and maybe a firefighter on it. But those tend to be more passive, right? They're not a 911 response. So I know Hayward has something like that. The city of Hayward has a similar program. I'm not well versed on it, so I won't speak to it. But we see a lot of that. Our program was really trying to, I think, plug a gap that we saw, which was when does the worst moments of somebody happen, and when do they need us right away? It's when they call 911, and having fire engines 7 minutes away on average from all these incidents was a better way to do it than having like one ambulance cover a whole county or a few teams cover a whole county. They're kind of, they get in the queue and they go meet with people. So it's a little bit different programs, but they're very valuable programs that they're doing in other parts, just not as aggressive and with a 911 base that we have. Would you agree with that, Chief Aguiar?
I would. That's a very fair assessment. And we've had, following the presentations that we've made at other agencies or at the conferences we've done, we've had numerous within the state as well as the nation that have reached out, and we forward them all of our policies, we forward them our procedures, we forward them the legal opinions that we've done. We're an open book of transparency for this program, and anybody that wants access to the documents and how we do it, we're more than willing to provide them, because our goal is hopefully we've created something that is scalable, that can be utilized by other agencies. And since we've done the hard work to get it to where it needs to be, we're more than willing to share it in whatever capacity.
Excellent. And I promised you all that we would end on time. So we're going to do that with one closing question for both Hayward Area Rec and Park and San Ramon Valley Fire. First of all, I wanted to thank everybody again for being a part of this, stars of our show, of course, both the attendees and the panelists. Gigi, thank you for the chat in. I will follow up with you offline about how we can do more to spread the word on this good work. And then I got one question here for Jim about, do you believe that mental health services are becoming a larger role in Park and Rec, or are Parks and Rec benefits being seen in a new light now? So if you could answer that as part of your close, and if both of you all could speak to any closing comments, thoughts, words of wisdom you want to leave folks with, and in particular, how can the state or federal government partner with you on either this type of program or just in general, helping you as a local government special district better serve your community? What kind of partnership and support are you looking for from the state and local, or excuse me, from the state and federal government? Thank you. I'll let you close, Jim, first, then we'll go to Chief Meyer and Deputy Chief Aguiar.
So the quick answer to the last question is therapeutic recreation has been a major in universities for years, and you see a lot of therapeutic recreators working in correctional facilities, these daycare services like we were talking about, some of them even in rehabilitation facilities. So it's always been a thing. I think that the real answer is this: as there's more people in the area and these problems come to surface and are lifting up a little more, you see things like our friends at San Ramon Valley Fire developing response systems, and you see people looking for help with these mental health and wellness issues. And so I think our role has always been there. I think what I would emphasize in closing is that we joked about being an essential service, but I think safe, clean, and green parks, being outside, our mission is health, wellness, learning, and fun. And you see health and wellness come first. We are a place, we live on tax assessment and small revenue generated by our programs, but we subsidize 65% of everything we do. We are affordable. You can rent a field for $5 an hour in our rec district for youth sports. So really, we're an answer to affordability and just being good stewards of the government and the public funds that the special district has allowed us to garner to be able to provide those specific services you opened the whole thing with, Kyle.
Wonderful. Thank you. Chief Meyer?
I will keep it very brief. The one thing that I think that we need when we talk about state or federal aspects is funding for these programs, because we've been fortunate enough through Lance Maples, who's on here, getting grants, having the ability to fund a lot of these things. And I know for other fire departments, there can be issues with that. So having funding and really looking at the training levels that are required for our first responders, I think it's big to look at it and then fund it so that we can do a better job for our community. like we're doing here. And we just thank you for the opportunity to share. And we're always open. If folks watching, need information, reach out.
Excellent. Paige, Jonas, Jim, thank you so much for your presentations today. Thank you for your service. And thank you to the state and federal officials and others that have joined us today for the live webinar and those watching on recording. We're grateful for your partnership and we look forward to working with you. With that, everyone, have an awesome year ahead and we'll see you next time. Bye-bye.